A young woman walks into the waiting room. She's accompanied by her sister. Her sister is quiet. She seems full of fear. The young lady has a lamp in her breast. When I get the opportunity to see her, she tells me, "Doctor, this lamp, I felt it 2 years ago." That chokes me. The lamp is now painful. It has spread, and there are nodes and swellings under the armpit. And the lady asked me, "Will I be able to see my children grow up?" A very painful question at this juncture, which nobody would be willing to face. My heart sinks. Because this story is not the first one. This happens too often. But here is the truth. Many cancers in Africa can be prevented or treated if found early. Hello everyone, I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. Here in this channel, the hope in healing cancer insights, we turn complex science into simple steps that you can use on a daily basis to protect your health. Today, we are talking about the most common cancers in Africa and why early actions saves lives. This information most of it is from the global cancer data compiled by the International Agency for Research on Cancer, the Global Can database. And it remains the standard reference for cancer statistics worldwide. So let's get moving together and understand the reality of cancer in Africa. Cancer is rising across Africa, and recent global data showed that more than 1.1 million new cases of cancer are diagnosed annually in Africa. Over 750,000 people die from cancer in Africa. The bad news is many of the cancer cases in Africa, they present to the hospital too late, when the treatment is very difficult and their outcomes can be grievous. That's why survival rates on cancer in Africa are lower than in many other regions of the world. The good news is we can change this scenario, and it starts with simple actions that you take as an individual, that we take as a society, and that's why this information is coming to you. Are you willing to take the next action to beat cancer in Africa? What are the most common cancers in Africa? The pattern of cancer in Africa is shaped by 1, infections, lifestyle changes, and then limited screening. Let's look at the most common cancers in women. Breast cancer. Breast cancer is the most common cancer in African women. Many women discover it when they feel a lump in the breast. When detected early, treatment is often very successful. But when detected late, it becomes very much harder to treat. Breast cancer is one of the cancers that can be easily diagnosed with screening. Ladies are encouraged to go for mammograms from the age of 45 or earlier, depending on your family history and your genetic risk. Being also breast familiar, where a lady examines her own breast on a monthly basis, is important. It's not as effective as a mammogram, and when you discover something that you are not sure, do not ignore it because it is not painful. Get health providers' assistance. Breast cancer can be cured and can be treated on time. The other cancer that is affecting our women in Africa is cervical cancer. Cervical cancer is another major threat to the African women. The main cause is infection with the human papilloma virus, which is sexually transmitted. The good thing and the good news is that now the vaccine is available, and this cancer can easily be detected and diagnosed 10 years earlier before it presents as cancer. Simple test like the VIA, which is a 5-minute test. Your cervix is just painted with iodine and the results can be seen immediately, and you know whether you are at risk or not. And then when abnormal cells are detected, they can actually be ablated before they turn into cancer. So it takes a long time. Testing whether you are human papilloma virus positive, and then taking our young girls to go for the HPV vaccine at the age of 9 to 13 years. Cervical cancer is one of the most preventable cancers. With human papilloma virus vaccination and screening, you can stop the cancer before it becomes dangerous. So what is necessary? Making that decision to go for a screening. Are you ready to do it? The test is simple. Just a little discomfort, but you cannot compare it with the pain and the discomfort of cancer. Prostate cancer is one of the most common cancers in the African men. The risk increases with age. If you're a man from the age of 55, discuss the risk of prostate cancer with your health provider. The screening tests are not that straightforward, but you need to have a discussion with your medical provider. Look at the history in your family of prostate cancer risk. A digital rectal exam can tell about how is your prostate, and then doing a PSA. This is in some people, this cancer is very slow growing, and so that is why mass population screening is not encouraged, but is personalized to the individual with your health provider and the risk that you have. When detected early, treatment options are far much better. Have you discussed this with your health provider if you are a man and you are 55? And if you have not, when are you going to have this discussion? Please make that decision. Liver cancer. This is another very common cancer in Africa. What are the driving risks? Excessive use of alcohol, infection with hepatitis B virus, use of aflatoxins, and these increase your risk of liver cancer. And now we are getting more cases of it, especially with the development of fatty liver with obesity. So vaccination with hepatitis B vaccine, now which is universal for children under 5, is part of the vaccination programs in our country, and so those who are born after the 2000, they have gotten the vaccination. But people in high-risk profession, like commercial sex workers, health workers, these people need to get booster vaccination to reduce their risk of getting hepatitis B virus and reduce their risk of getting liver cancer. What is your risk and what is your status of hepatitis B vaccination? Have you gotten the booster vaccine if you are among the at-risk groups? Colorectal cancer. Colorectal cancer is becoming a killer for many of the young people from the age of 45, men and women alike. Colorectal cancer is increasing in Africa. This is because of our changing diet to more of the ultra-processed food, less physical activity, and obesity is increasing. The good news, polyps that turn into colon cancer can be detected years before they become cancerous. When are you doing your next colonoscopy? If you are 45 and you have not had a colonoscopy recently, visit us at Wellness Health Services and schedule your colonoscopy. It will save your lives. I've seen many patients present with colon polyps. They have been removed, and many have seen them live for many years, and the risk of cancer eradicated. So, remember changing diet and going for more real food, being exercise, being active, and also working on your body weight reduces your risk of colon cancer. It's one of the cancers that is associated with obesity. Remove the ultra-processed foods from your diet. Go for a screening test. It is available. At Wellness Health Services, you get the test and you get it at an affordable price and with all the comfort that you need for the test. Take the action. Do not wait for tomorrow. Make that decision. We prevent colon cancer. Why do these cancers hit hard in Africa? Imagine a grandmother in a rural village. She notices unusual bleeding. She thinks it's normal, or she's so embarrassed to go and talk about it to a healthcare provider. Years later, when you cannot afford to keep it to yourself, you present to the health facility. The cancer has spread. It has gone beyond its primary organ of origin. The family loses someone who held them together. Imagine a father ignoring the symptoms of prostate cancer. She feels embarrassed to seek help. She cannot talk about her urinary problems with a health provider. By the time she comes to the hospital, the cancer has spread. It is advanced. He may miss seeing his children growing up just because he feared the embarrassment. This is not a one-day thing. It is the daily occurrence in many of the health facilities in Africa. These stories are very painful, but many could be prevented if only we became courageous enough, we start talking about these things, and we do the necessary screenings. Early action saves life. If nothing changes in Africa, cancer cases could double in Africa in the coming decade. But we can change this future. It is within our control. What makes a difference is not talking about it. It is taking action. Are you ready to start that action to save yourself, to screen for the cancer that is appropriate for your age. Get screened when possible. When you find something that you are not sure of, go for health assistance. Women should check their breast regularly and they seek screening when available. If you are above the age of 45, you have never done a mammogram, please think about it. And don't think about it, take the next action, go for a mammogram. If you have never done a VIA, you are more than 25 years, and between the ages of 25 and 65, go for the VIA. It will save you agonies of dealing with cervical cancer. So cervical screening and human papilloma virus screening protect women and girls against cervical cancer. Men at risk of prostate cancer should talk to their health providers about their risk and what to do. Healthy habits help. Avoid tobacco. Be moderate in your alcohol use. Eat healthy food. Stay physically active. Early detection turns deadly cancers into treatable diseases. Cancer is frightening, but it is not always a death sentence. When cancer is found early, many people survive and live full lives. In my clinic, I see survivors every day. They are strong, they are grateful, they are living proof that early action saves life. Do not wait for pain to force you to act. Protect yourself, protect your family, stay healthy, stay strong. If this message has touched you, subscribe to this channel, like the video that many people can see it, forward it to a friend, a family member whom you think needs this. We become warriors against cancer. And subscribe for more honest health conversation about cancer in this channel, Hope in Healing Cancer Insights. Tell me about what have been your experiences with cancer in the comment section of this video. If you feel you need any of the screening tests for yourself, then visit the Wellness Health Services Medical Center in Machakos, or you can give us a call for personalized advice on what to do and what are your age-appropriate screenings that you need. Thank you for watching. Let's stay healthy. Let's share with each other. I see you in the next video.